So this patient complained about lateral side pain that can be many different things. It can be ITB syndrome, it can be the hip issue, it can be many things. It can also be the adductors that contract like this when she's exercising. So we will try to figure out what's going on here and see how we can treat that differently from the other tools. One thing that we also always check, of course, is the length of the legs, if they are the same or not. And here it's quite obvious what her problem is because she actually rotates internally with both knees. So when she exercises, it will probably be the same. So here I will start to give you lie down, please. The examination can be painful, but I will remove the pain.
Okay.
So I will start, because of a complaint, up over the hip and trochanter area here in the pelvis.
Yeah.
So here, it's inflammation here. I will follow down, going down to the ITB here. Yeah, and here it comes. So now when I go below the ITB band here and into the thigh to find a nerve, and now you can see what happens when she trains and she gets tight in her legs, she rotates. So we can actually simulate the injury she has and the problem she has, and in this way find out what treatment I need to do. So I continue here. Yeah. So definitely ITB syndrome. We go to the end of the tendon here. And because she is a nice woman, I'm very gentle. So, and we can also see here she have a little bit of spider net formation on her skin. This is indication of chronic inflammation. When the blood cannot flow normally, it finds its own way to move around. With this problem, she probably also have issues in adductors. We check sartorius first. So every patient, no matter what, we check everything very, very detailed because it's really important. The pads, patella tendon, move the patella, put pressure on, there's no pain, which is good. If it would be a chronic knee pain, she would feel pain during this examination. The joint line. And also here, the medial hamstring. That means I will also find for sure in the adductors. So we go in between. You can see how easy it is to come in between the muscles. And here comes the pain. She's very happy. Not so happy. Definitely not happy. We go here, put pressure on the adductors into the here and put down. So this is just nice and easy. Okay. If you go on your stomach, please. And we can see the circulation issues. So just to be sure, just see so we don't have any issues with the meniscus or anything. A little bit too much rotation here. And as you remember, I find something here on the hamstring here. Yeah, for sure. We checked also the lymph here. Lateral side. Okay, so we will create a different protocol here. We will try to do the adductors here. We will go the ITB and the blood flow and circulation. If you go on your back again, please. You bend the knee and make like this a little bit here. So we're going to isolate adductors here because this, of course, when you do like this, create a lot of problems. We use the same devices. We use the low frequencies just to show you. I can guarantee you 70% or 80% of our knee patients and hip patients is the adductors. But it's actually, this is the only thing that can remove that problem. So we put it on the side here of the adductors. That's the positive, 1, 2. And then it's very important when you place the negative, don't go all the way to the knee. In the middle part here, because here in between is actually creating the problem. Here is not so much pressure. You will see when I check this again, it will not be so painful as before, because you need to understand how the different nerve is branching out and what is doing what. I will use remove the free radicals again, the problem that create the problem. I put one here. I need to use the carnosine. I put one here to renew the tissue cells. And already now it's better.
Yeah.
Yeah.
Okay.
Something like this. Here on ITB, I need to do a different. Can you lie on this side, please? So I want to increase the movement of iliofemoral band. At the same time, I want to do anti-inflammatory. So we're going to use energy. Right. So I'm going to put the positive energy here. Okay. Now use the negative. And this one, I actually go all the way to where it ends. Because they can work the whole body or they can work shortly. But this because I want to extend this, because the energy device can extend the movement of any muscle or tendon up to 53%. So we release the pressure here. Then I will use the anti-inflammatory. I can do this advanced or I can do it simple. I decide now to do it somewhere in between. I just hold this up. I put the positive here. So I'm just going to do a little bit of a zigzag pattern here. And it's important you end the positive anti-inflammatory over the energy, right? And we put the negative here, here, and of course here. We use the antioxidants. We're going to put here. Here is more pressure, of course. So we're going to have the glutathione here and the carnosine here. So renewing cell, remove free radicals. Lie on your back again, please. Okay. I'm going to go under the ITB again to put pressure on the same nerve and see what happens, but 100% more pressure because I really want to irritate it now and get confirmation it's getting better. I need to hold it. How does it feel now?
Much better.
No screaming anymore.
I feel pain, but
Not as before.
not as before.
So now I'm checking just for details because I had the hamstring issue here. Yeah. So this one I need to remove here. You have the positive, please, and negative. So we have 1, 2 really chronic problems. Now I'm going to take the hamstring here and also a bit of sartorius at the same time. 2 positives. And we're going to use the negative up here and one negative right up here. And all of these can also work with the one up here. It's no problem. I will use here glutathione. And now I choose to remove the free radicals and also one to remove the stress, because this is created because of the other two that this is trying to compensate. So when she train a lot, 3 times a week, with all these rotations, all of these get overused. So we remove the stress here as well. And then we check.
Much better.
Different?
Yes.
And the resistance here now is a lot less than before. So what we show you here today is 3 or 4 different ways how to treat knee problems. 3 or 4 different ways what could be the source. It can also be the hip, it can be the lower back, it can even be stomach issues because it's the same nerve system. We need to understand the nerve system is a closed system. Everything negative that goes on anywhere in the body will spread all over the system. One day, sooner or later, it will affect us as humans, no matter what. So now I'm controlling this ITB again. And I really provocate it now, even if I use very low frequency. What I want to feel is less tension, that is less stressed and softer, and not hard and painful. And this. And also the angle of the leg is different. It's not so over-rotated as before. Even if I put pressure on the nerve here, the leg is relaxed, which is really important. And the adductors here go in between. I always locate the main nerve here and the branches on the femoral nerve. And if they lie relaxed as you do now, it's good. And believe me, I can't find anything. See, stand up and see how it feels in your leg.
Better.
If you do a squat, stand to, you see how the right leg is want to rotate, but the left doesn't do it anymore, which is really important.
And I used to feel pain here when I used to that. And now.
Weird. Yeah. So this is also very common for football players, ice hockey player, runners, adductors, ITB. And you can also see how edema removes from the adductor area. You can see where the disc is sitting, that you get this crater in the tissue. So it means you had the problem for quite some time, for sure. But we will make sure you come back and fix this permanently.
Okay.
I hope you enjoyed this session. I did, and we have a lot more to show you in the future with different topics, how to treat different problems. And I guarantee for all of you, this will change everything in your clinic. Not only for you, your personal knowledge and the personal understanding of neurological and biochemical function of the body and the frequency medicine, but also for the status of your clinic. And most of all important, for your patient. This is another tool with all the tools you have that can make life even better for your patients. Thank you for watching.